Hello, everyone. Welcome. I'm so happy and grateful for this opportunity to share this information with you. We had over 100 registered on this call, and I'm so excited to know that you're all invested in promoting self-healing. So I'm honored, and I applaud you for your commitment to this goal. Just a quick introduction to those who do not know me. I'm Dr. Cynthia Thaik. I'm Harvard-trained cardiologist. I've been practicing medicine for over 20 years. I am the founder of Revitalize You, a health and wellness center whose goal is to promote a patient-centered and patient-directed healing. I've authored a new book, Your Vibrant Heart, Restoring Health, Strength, and Spirit from the Body's Core, which will be released in February of 2014. Okay, let's get started. Being free of disease is not equivalent to having health. Now let me repeat that. Being free of disease does not equate to being healthy. For those of you who have truly experienced optimal health, vibrancy, and vitality, you know what I'm talking about. When you're generally not feeling well, but there's no specific disease. Listed here are some of the common reasons why a patient goes to see a doctor. And on the surface, they might all seem to be disconnected. Cough, congestion, hormone issues, high blood pressure, pain. When a patient goes to see a doctor, they want to know what's wrong with them. They want to know what's the root cause. They want to feel better. Here we see a list of symptoms, many of which are vague and nonspecific, and not necessarily going to make you run to see a physician. But they might be clues of the imbalance within your body. These symptoms can all be part of food allergies or reaction, and they can all be linked back to adverse reactions to food or imbalance in our internal milieu. I always like to teach my patients to listen to their bodies, whether it be with a physical symptom or emotional and mental symptoms. These symptoms are messages from their bodies, messages from the inner guide telling them that there is an imbalance in their body. Oftentimes, we either don't listen to our bodies or we hear the wrong message. Oftentimes, the message is not something serious like you're having a heart attack or a stroke, but more benign message like you're not eating well, you're not sleeping well, you're taking too much caffeine or alcohol. I coach my patients to listen to their bodies with a disinterested curiosity. Let me explain to you what I mean. I want my patients to get curious about their symptoms, but not to get too emotionally involved in their symptoms or invested. I want them to be able to look objectively at their symptoms, much like I or another physician might, but not get emotionally attached. This will help minimize a lot of stress that I see around health. Now let's go back to our biology class when we learned about the various systems within our body, the circulatory system, the digestive, the nervous system, skeletal, respiratory, and so on. We learned about them as separate systems, isolated and having a life of their own. We see different doctors for each symptom, and intuitively we know that they're all interconnected. Well, in functional medicine, we view these independent but interrelated, and over the years we've learned that the gastrointestinal system is the interconnector, the link that connects all these symptoms, and we have the ability to fix our body by focusing on the health of our GI system. Now you might ask the question, why is my cardiologist talking about the GI tract? Well, 4 years ago, I wasn't feeling well. I felt tired and drained and exhausted. And after a series of testing, it turned out that I was severely anemic and I needed blood transfusion as well as surgery. Well, let me tell you, it feels very different to be on the other side of the hospital bed sheet. And it made me acutely aware of the vulnerability as well as the frailty of life. And now I have a renewed appreciation of the true meaning of health. Well, around the same time, I was presented with a unique opportunity to be one of the very first clinics in the United States to offer a revolutionary dietary program, which is an FDA-approved program developed by a French physician called Ideal Protein. Some of you on this call have participated in this program. This program, along with other detox and coaching programs, have led our clinic to help over 500 patients in the last 2.5 years lose over 10,000 pounds. Now, I want to do a quick shout out to my staff member, Brenda Morales, who's largely responsible for the success of my clinic, and she's done a marvelous job educating and coaching our clients to success. Now, let's get back to cardiology. Even with hardcore diseases that I treat, like hypertension, diabetes, coronary disease, we know that inflammation and toxicity are responsible for much of the root cause. In fact, I don't know if you're aware that cholesterol acts as a band-aid within our blood vessel, going around and lining itself over the areas of the blood vessels that have been damaged by sheer stress of high blood pressure or injury of, or acidity of blood sugars or free radicals and inflammation. Inflammation also plays a vital role in the development of diabetes and obesity. In fact, our fat cells act as a protective reservoir for toxins within our bodies, and therefore, if our bodies are loaded up with toxins, it's virtually impossible to lose weight because the fat cells are necessary for survival. Listed here are some of the inflammatory and non-inflammatory foods. Well, here's my wellness triangle. Health involves more than physical integrity. Our social, mental, and emotional health is as vital and important a role, and arguably maybe even more important. More and more, I believe that a whole life approach to health, which is that in order to have optimal health, you need to have a balance in other areas of your life, be it our relationship, our vocation, our time, money, freedom. Today, we're going to focus on our physical health and bodily detoxification. But next month, I will introduce my mental detox program, which I'm very excited about. Following along with the wellness triangle, here are my 3 arms of physical health. Well, nutrition and fitness, we're all very aware of as a society, but detoxification, not so much. What is detoxification? Detox is the cornerstone of healing and of prevention of disease. Detox is about resting our body, cleansing and nourishing our body. This is something that I recommend we do at least several times a year in some form or another. Why is detox important? Well, over the years, with all the abuses that our body has withstanded, our bodies become loaded up with toxins, and it can make us very sick. Let's look specifically at some of these toxins. Well, they're environmental toxins, pollutants from the air, exhaust, solvents, heavy metal, pesticides, herbicides, and insecticides. Even sunlight can cause free radicals to form within our body. Then there are the lifestyle toxins. I like to say our vices, be it nicotine, caffeine, alcohol, or food. And let's not forget the drugs, be it prescription or recreational. Now, let me be clear. I'm not endorsing anyone try to get off pharmaceutical, at least not without supervision. But as much as we can, our goal should be to safely and with supervision come off medication. And we've been able to do that successfully for many of our clients. Then there's the internal toxin, the microflora that exist within our bodies, as well as the emotional toxicity that we often pollute our mind and our souls with. Now, this is a topic that is very near and dear to my heart. Not in this program, but shortly thereafter, I will introduce my mental detox program to help clear emotional blocks and to shift perception. Before we can understand how we can help our body, we need to understand how we have failed our bodies by eating the wrong food, hydrogenated oil, food that has been manipulated, processed, and preserved, or even worse, food that has been genetically modified, such that our bodies no longer recognize these foods and they're considered foreign to our system. We also eat too much, eat too fast. This all leads to inflammation, which is toxic to all the systems of our body, not just cardiovascular. It can lead to diabetes, Alzheimer's, cancer, arthritis, autoimmune disease, neurologic, and pulmonary. Now let's go back to our friend, the GI tract. There are 4 pillars to GI health. Digestion and elimination we are aware of. But let me speak a little bit about the microflora and the gut integrity. Remember that in the gut, there are millions, if not billions, of good bacteria, protozoa, fungi, and other microorganisms that live in symbiotic harmony with us and protect us. And it is vital that we maintain a healthy microflora. But over the years, numerous courses of antibiotics, elevated blood sugars in our bloodstreams, and so on, have changed this flora. Candidiasis, or Candida albicans infection, is something that plagues us. It's a fungal yeast infection that naturally presents itself in the healthy gut and assists in a check and balance system with a good bacteria. So when there is an overgrowth of this yeast beyond the normal level, it can spread throughout the GI tract and worse, get into our blood system and throughout our body. Within our bloodstream, this yeast changes into fungus, which spreads throughout the tissues and form colonies, and it can be as much as 300 microtoxins that can be excreted into your blood system. As you can imagine, this will cause havoc on our bodies. In addition to cancer, here's a list of other symptoms and diseases, including chronic sinusitis, chronic fatigue syndrome, fibromyalgia, leaky gut syndrome, which I will talk about next. The leaky gut. This is what happens when we lose the gut integrity, the last pillar of GI health. The gastrointestinal lining is very much functions in the same way that the skin does in protecting our body against the environment. Now, there's a statistic that in one day, the GI tract defends itself to the same degree as the skin does all year long. As you can imagine, thank goodness we're not sitting in a mud bath or worse, a pig pen all the time. Whereas our gastrointestinal lining is exposed to harmful bacteria and toxins on a minute-to-minute basis. So leaky gut syndrome is when bacteria, toxins, digested and undigested proteins and fat, and waste materials can leak out of the gastrointestinal tract and into our blood system and trigger an autoimmune response. And I'm sure you've all experienced symptoms of bloating, gas cramping, food sensitivity, aches and pains, and many other symptoms that were listed earlier on the slide. So how can we maintain a healthy GI tract? Well, there are the 4 R's to gastrointestinal health. The first is removal of allergens, toxins, and harmful organisms. In essence, an elimination diet. In addition to our diet, we want to be careful about our environment and all the chemical exposures, and as much as possible go green. Then there's replacement, making better choices in the diet, eating whole food. Reinoculation is about correcting the microflora balance. This is where probiotics come into play. And then there's repair, when we've done injury to our gut. The anti-inflammatory and liver immune supports and supplements, which we'll be providing here, can help with reestablishing gut integrity. So what are things that you as a patient can specifically do to heal your body? Well, 1, eat less and be mindful. Mindful eating is a practice steeped in Buddhist tradition. Here are some easy steps to bear in mind. Eat slowly. Savor the silence. Turn off external stimuli, be it television, music, or even conversation. And lastly, bless and send loving kindness to all those hands that have touched this food before it reached your plate. You want to pick the right food. Pay attention to what you're eating. Ask this question: will this nourish my body, or is it likely to harm me? Make healthy choices. You've probably heard this old adage: eat breakfast like a king, lunch like a queen, and dinner like a pauper. And if you do, you'll have a body like the one down here, as opposed to the one up top, which we often see associated with metabolic syndrome or central obesity. Now, I know a number of my patients, and Michael, if you're on this call, you know what I'm talking about, who feel like they already eat like a pauper all the time and still nothing is happening to either their weight or their health or their symptoms. So clearly we know that our symptoms is much more complex than we are what we eat. And we do need to rely on internal organs to help us out. Our body is a complex detoxification system, with our liver leading the charge. Other organs of detoxification include the digestive system, the kidney, the spleen, the lymphatic, and the skin. I will talk in more details about these vital organs on our next webinar. Here are the various detoxification programs. We've heard of them all. We've tried some of them. There are external methods that rely on the skin, the lymphatics, such as dry brushing, detox, ionic foot bath, or even the saunas. And then there are methods such as exercise, yoga, qigong, martial arts, and even the trampoline rebounder that relies on the lymphatic, our muscular system, and our circulatory system. Then there are the internal cleanses, such as colonic cleanse, the master cleanse. These type of cleanses are all geared towards elimination and the removal of toxins within your body. Now, if these type of detoxification program might be enough if you do them on a regular basis and you lead a fairly clean life. But all too often, if this is your first detox program, or even yet if you're overweight or obese and are storing a lot of toxin, then engaging in some of these detox programs can actually do you more harm. It can release toxins into your blood system that can actually lead to worsening symptoms. And that's why a more complete and thorough and supervised system comes into play. So you need to ask yourself this question: do I need this detoxification program? Only you can answer that. You need to look within yourself and ask your inner guide that question. Then you only need to vision the life you would love, the health you would love, and move forward. So this is your opportunity to join us and experience what functional medicine really has to offer.